Nilikuwa nataka kuona uvivu. Geuka kuja tu. Kuja. Iko chonjo.
Asante.
Niongea hapa sasa.
Kazi nzuri.
Haya.
Yes, sir.
Ayumbi kiati kinongele tungi. Lakini ona ngombe lana hedela. Nikia anga indi kiamu.
Tuimwe
maybe it's hiyo ya level 5 hiyo lab. Kuna 2 days to tupone tuvivitaniti with the subject is ya squeeze wa with ya unena Friday aya mwe tuendete sawa tie chao zibau tie chao purity wonkie leo tatu samu
So basically this week ni governor peke yake. These are my media people, media center, media media center, broadcast.
It shows your PR background.
Yes,
Prominence of media.
So we have about 8 toilets in the building, 8 different sets for ladies and gents. So in here is my
Without masks.
Very good.
Let the other media come. They're not shown us in the office here. Seat for my deputy governor. Tunasumbua. Mimi na nikitoka hapa very able neighbor from Kajiado who we share level 5 together with and a very good neighbor at that. Karibu Governor.
Asante sana.
And the chairman here somehow miraculously managed to get that wiped off, which is very good. And with him, I'm confident that healthcare will remain devolved because it should be here. Chairman, conclude.
Maybe implement this. 43 county governments received a donation of 86 oxygen concentrators from Crown Healthcare, 172 infrared thermometers, and 86 pulse oximeters. This disease can only be controlled by early identification, intervention, and treatment. Additionally, we welcome the move by the Inspector of Police to set aside police holding facilities for those who violate the curfew and lockdown rules separate from county quarantine facilities. The process of shortlisting and interviewing the candidates was completed on 30th April 2020, as we had earlier informed you. The newly recruited 5,550 health workers will begin to report to their various workstations on different dates this month. Plans by the national government to hire additional 1,156 health workers is welcome. This will bring the total number of health workers recruited to 6,656 as agreed upon by the national government and the Council of Governors. Secondly, disbursement of funds. We wish to inform you that county governments have set aside a total of 6.1 billion in their various supplementary budgets towards the fight against the virus. However, at this moment, we have not received any funds from the national government, but we have that commitment of 5 billion. We urge the Ministry of Foreign Affairs to come up with a protocol of dealing with neighboring countries that will only allow limited access, if at all, in order to curb the spread of the virus into the country. I wish to report that from last week, 5 more counties have formed county food security war rooms, bringing the total to 40 counties. The data being collected by the county food security war rooms is being used to inform policy decisions, to enhance food access and easy doing business in counties. From the reports that we have received, we have identified and are addressing the reducing stock levels of food stores and shops. Counties continue to ascertain the vulnerable households and are consulting with the national government to ensure that these households are supported with food and non-food commodities.
It is important to understand that very clearly, that we are not out of the woods.
and the numbers are now rising. Obviously, the numbers are rising for two reasons. One, we are able to do more testing than before, which means the disease is now with us. Now that we are able to do more testing, it actually is evident that the disease is spreading and spreading very fast. So I have not done any research, but my thinking is that August, July, we may see very, very high numbers. So it is important as leaders and as government that we keep telling you, and it is also important, citizens, to listen and still take with you the caution that you have started earlier. I see like we have relaxed, and I insist that we stop relaxing. If you have no reason for going to town, stay home. If the kids are at home, schools have closed, and I see a lot of them in the field playing football. That should be avoided. We have avoided, citizens are now avoiding to go to hospitals for fear of contracting COVID-19. So our immunization rates are going down. Our maternal MCH clinics are receiving less expectant mothers, so mothers are not going for antenatal clinics. Malnutrition is rising because the measurements and the care for those ones is also going down. Other outpatient clinics attendance are much less. I will therefore ask county governments to fumigate hospitals very frequently, and also to create awareness about the fact that the hospitals are fumigated and therefore safe for patients to visit hospitals.
Unless something is done to address the border movement, which actually require complete closing down, complete shutdown. We appreciate that that is a function of the national government, but it's important for me to reiterate the urgency with which there is need to address that problem. And this goes the same way for our borders with Somali, our border with Uganda, and any other international borders. Seeing countries take decisive action in closing down or in shutdown or lockdowns have helped in a big way to flatten the COVID-19 curve. And so that urgency is something I want to put an emphasis. As we encourage citizens to stay at home, it is important for us to realize that many of our people, and particularly in towns, are dependent on their daily casual jobs to eke a living. As a result, the much talked relief to vulnerable families is long overdue. It is out of that inability to fend themselves, is out of hunger that we are seeing Kenyans defying directives and going out to work as normal, even when the situation is still very fluid.
Counties are key to fighting COVID and to provision of healthcare. And let me say this clearly. We have seen a move by people who want to take healthcare back to the national government. Before counties were formed, healthcare was in shambles. Hospitals were smelling. People were dying left, right, and center. There were no ambulances. Here in Machakos, for example, when I got in, we used to have only 6 ambulances and 4 on top of rocks, and 2 did not have fuel. Now in every administrative location in Machakos 75, there is an ambulance. And it's the same story in all counties. And so, as a result of health being devolved, we have hired more health workers, and we are able to manage them to ensure that they are there, they are working, they're not putting on a jacket and going to their clinics. We have cleaner and better hospitals. We have improved infrastructure. Look at go to Kakamega and see the level 6 style of hospital that is doing there. Go to Kisii. I went to Isiolo the other day. I was shocked by the work that has been done in Isiolo. Go to Kajiado. Look at the work that the governor is doing in healthcare. we are able to manage our issues and any outbreaks better from here, because even our community health workers, they relate with us, they can go all the way to the village and we can manage epidemics. The reason some people want to take healthcare back to the national government has nothing to do with provision of healthcare. Hapana, ni kwa sababu development partners are now funding facilities directly. They are funding counties directly because development partners have realized the money is better used when it is channeled to counties and not going through the national government. The national government, there are some people who still think of it as central government. And you know how it operates in Afya House. For many years, cartels have formed, and now they are missing. All this money used to be used for things like funding political games, getting into people's pockets, pharmaceutical wars, cartels in Afya House. So as a result of that, they want the money back. It is all about corruption. So wananchi, wakati mnasikia ati healthcare irudi national government, ni kwa sababu wanataka kula. Hawajali kuhusu mwananchi atakufa, hawajali kuhusu daktari anatibu, hawajali maslahi ya wafanyikazi, wanataka kula pesa ya mwananchi. Tutanyonywa mpaka lini wa Kenya? Tutanyonywa mpaka lini? Tumenyonywa. Sasa tumeisha kabisa, hata pumzi ndio inatoka kwa damu yetu, kwa mifupa na kwa mwili wetu. Kwa hivyo tujue ya kwamba any attempt to take back healthcare to the national government will be basically finishing Kenya. We'll go back to 1960s. It will be a tragedy. Na naomba wananchi wote katika nchi yetu ya Kenya tupinge ufisadi na tupinge ukora wa kusema mambo irudi pale center. Mtu ambaye hajafika Machakos, hajafika Nguluni, hajafika Shamahoho, hajafika Oloitoktok, mtu ambaye hajafika kule Isiolo katikati, ati yeye amekaa Afya House ndio anaamua vile mambo yataendelea huko kwa hiyo dispensary ndogo. We can make it 3 questions please. 3, 4. Thank you.
Thank you, Chairman. Ali Athman Mumina, Radio Salam. Your Excellency, my question is about contact tracing. Mohamed Kuti, Governor earlier, Bulahaw in Somalia, Ethiopia, and then Kenya. This is the month of Ramadan, and went to pray Bulahaw, Somalia. Working governors doing to prevent this border movement. And
I am Rose Mokonyo, working for Radio Maisha. My question is, we have seen in Machakos County that the governor, what is the Council of Governor, or what is the council going to do about other counties? Because we have seen a picture on the internet whereby an applause. So are we expecting to see the same being replicated in other counties?
But people interpret it differently. But people need to be told this is a map of development. Yeah.
With your Kenya.
so you was so nana si mpesa ni